The General Assembly will resume its consideration of Agenda Item 131, entitled Global Health and Foreign Policy, to take action on two draft resolutions issued as document A/75/L41 and A/75/L47. I now give the floor to the distinguished representative of Indonesia to introduce draft resolution A/75/L41.
Thank you very much, Mr. President. Today I have the honor to introduce draft resolution A/75/L41, entitled Global Health and Foreign Policy, Strengthening Health System Resilience Through Affordable Health Care for All, under Agenda Item 131 on behalf of the 7 core members of the Foreign Policy and Global Health Initiative, namely Brazil, France, Norway, Senegal, South Africa, Thailand, and my own country, Indonesia. The Foreign Policy and Global Health Initiative was established in 2006, and since 2008 we have introduced annual resolution on health-related matters in the General Assembly to advocate strong interlinkages between foreign policy and global health. This is even more relevant during the current global COVID-19 pandemic that affects everyone, everywhere. Mr. President, this year at the 75th session of the General Assembly and under Indonesia's chairmanship, the Foreign Policy and Global Health Initiative has the honor to introduce a draft resolution on global health and foreign policy with a focus on affordable health care for all. It is an essential priority for international development that everyone, everywhere should have access to quality and affordable health care. Unfortunately, half of the world's population are still awaiting to exercise their rights to have that access. According to the WHO, every year, some 100 million people around the world are impoverished by catastrophic healthcare expenses, particularly in remote areas. Even when healthcare is available, it often fails to cover the full spectrum of human suffering, including those with mental health condition. This condition became worse during the current pandemic. Therefore, this pandemic is indeed a sobering reminder for all of us that health is the precondition, outcome, and indicator of sustainable development and one of the foundation of social, economic, and political stability. Health issues should not be politicized to merely entertain the interests of particular parties. It is much more significant for us to address the availability, accessibility, and affordability healthcare for all. 2 days ago, on the International Universal Health Coverage Day, we were reminded once again about the need for strong and resilient health system and universal health coverage with multi-stakeholders partners. Mr. President, with that in mind, the draft resolution that I have the honor to present today strongly urges all of us to strengthen national health system by ensuring affordable health care for all with the focus on primary health care. This also reiterates our commitments to provide access to affordable quality health services and quality, safe, effective, affordable, and essential medicines, vaccines, diagnostics, and health technologies. Access to affordable healthcare is an essential component to respond to and recover from COVID-19 pandemic and other public health emergencies, which are clearly addressed in this draft resolution. During this unprecedented pandemic, which is predicted to be far from over and might be not the last one, global solidarity and unity are more important than ever. Fundamental human need. Let us seize this opportunity to set politics aside and focus to address this humanitarian crisis for the interest of everyone. Mr. President, the draft resolution has been prepared through continuous engagement in an open and transparent manner, which resulted into a well-balanced and strong message. We are also pleased that the draft resolution is welcomed by almost all member states and observers in the General Assembly. I would like to thank all member states that co-sponsor and support this draft resolution, the World Health Organization, the Office of the PGA, as well as the Secretariat for the cooperation during the whole process. In conclusion, I call on all member states to support this very important and timely initiative and to join us in adopting the draft resolution as it stands. Full support to this draft resolution is the support for global health, dignity, and the respect for human rights. In time of COVID-19, now more than ever, it is time for us to enhance global solidarity for the sake of the human race, for the sake of humanity. I thank you, Mr. President.
I thank the distinguished permanent representative of Indonesia. Cedo ahora el uso de la palabra al distinguido